Dr. Pickering, today at the Glaucoma 360 meeting, your presentation was on steroids and glaucoma and the sudden impact. Can you give a summary of your talk?
The gist of the talk is to remind us about what we already know, which is how impactful steroid medications can be in our glaucoma patients and how damaging. But the fine points now is that steroids are more prevalent. They're being used by more physicians for more applications in patients, and we need to just always be aware that they may be causing pressure spikes and uncontrolled damage in our patients when we may not suspect that.
So basically in terms of what does this mean to the clinician when he sees something like this?
We need to raise our index of suspicion that when a patient is uncontrolled, if a patient is worsening, if there's an unexplained increase in intraocular pressure, to ask the patient carefully in their medical history taking about steroid medications. Many patients are on steroids and don't realize it and don't realize the importance of steroids and the impact it can have on their glaucoma. They're available over the counter now, so they're much more widely available. People are using them in pulse treatment, they're using them casually for allergies, and it can have a very deleterious and long-standing effect on the patient's eye health.
How prevalent is the use of steroids in relation to glaucoma?
We don't know.
No?
We don't know. But the problem is that for glaucoma patients, they're at higher risk for negative side effects from steroids, and many of them are not aware of it.
Does it increase the potential risk in their glaucoma?
It increases the risk of them developing glaucoma, and also if they have glaucoma, they may progress more rapidly. They may also be pulsing the steroids, using it casually here, casually there, when they're not under direct observation, so we may be missing pressure spikes that are causing damage that we can't quite account for.
So what would you recommend to glaucoma, physicians in dealing with their glaucoma patients?
If there's a patient with unexplained progression, worsening, or unexplained high eye pressure, step back a bit and take a more careful medical history. Ask about creams. If you ask a patient, do they take steroids? They say no. They say, well, wait a minute. How about that cream? Do you use anything for a rash or eczema or atopic disease? Oh, yes, I do. And then it turns out to be a high-potency steroid. Do they take anything for thinning hair? There's actually a hair solution that's steroid-containing. Do they take anything for allergies? Yeah, I take an over-the-counter allergy medicine from the drugstore or the supermarket. There's so many applications, and the availability of steroids now is so widespread that I think we're missing a lot of patients who are using steroids.
Thank you, Dr. Pickering. Appreciate your time.
You're welcome.